A DNR is not required to initiate hospice care, and there seems to be a myth that it has to be in place. Indeed, that's not the law, that's not the requirement, and I like it that way because it allows the team of caregivers from hospice to help the patient and family work through their own fears and come to this decision without it being forced upon them.
People often believe that you have to have a DNR or a do not resuscitate order to be on hospice, and that is not true. You are not required to have a DNR to be in hospice. In fact, you cannot be required to have a DNR to be on hospice. Nobody can require anyone to have a DNR. This is a personal choice for the patient and their family. And so what we do in our role as hospice workers, the social workers and the chaplains, and even the nurses, we educate people about advance directives and about DNRs and also power of attorneys, so that they can make an informed decision. I always tell them, this is a conversation simply to educate you on what your rights are, and we want to know what your wishes are. So as the social worker, I can advocate on your behalf and make sure that your wishes are upheld. We do encourage people to get their wishes in writing, because we know that especially if there's any kind of family conflict, when the time comes, it may create problems with the person's end-of-life wishes being upheld. So the best thing for anybody to do, anybody over the age of 18 should have their wishes in writing. A DNR is not for everyone. A DNR is really reserved for the very elderly and the terminally ill. So I wouldn't encourage everyone to have a DNR, but I would want them to know what that is. An advance directive is actually something that everyone should have. If you're 18 and older, you should have an advance directive in place. An advance directive actually guides care for a person while they're living, but unable to speak for themselves. So does a person want to have a feeding tube if they're unable to speak for themselves, or if they're unconscious? Do they want to have artificial hydration? Do they want to vent? All of these things that come up in cases of emergency or crisis, if something should happen to someone, it's important to have these conversations with your family or the person who's going to make these decisions on your behalf, and it's really important to put it in writing. So the social workers and the chaplains do a really good job of educating on these documents and then assisting with getting them in place if that's what the family so chooses.